Here we can see the half-head model, which is a great way to look at the respiratory tract and the digestive tract, right? So the digestive tract, the shared respiratory tract. So we'd be looking at the nasal cavity, the pharynx, the larynx, and the esophagus, right? So looking at the nasal cavity, the entrance is going to be the nares. One would be nare. And that leads to this empty space here called the vestibule, which would normally be filled with hairs that filter air coming in. Then we're going to see three bones, the inferior nasal concha, middle nasal concha, and superior nasal concha, which each have a meatus, or a space underneath them. So this space here is the inferior nasal meatus, middle nasal meatus, and superior nasal meatus. Getting towards the end of the nasal cavity, we'd see this hole right here and this tonsil as we're entering the pharynx. So this is going to be the eustachian tube, or now the auditory tube. This tonsil is going to be called the pharyngeal tonsil. This marks the beginning of the pharynx. So this would be the nasopharynx, named for the nasal cavity. This region right here, behind the oral cavity, would be the orinopharynx. This region of the pharynx behind the larynx would be called the laryngopharynx, right? And then we get down to the esophagus, or the larynx. Okay, so in the orinopharynx, we're going to see two tonsils. We see the linguinal tonsils and the palatine tonsils, right? If we're talking about the respiratory tract, the next thing we would track down into is airflow would go into the larynx. Now we have, right here, we have the hyoid bone. Then we're going to see the thyroid cartilage. And we see large posterior, small anterior, the cricoid cartilages, right? This structure right here is the epiglottis, which is pretty important for when we're swallowing, so that we can close off this opening. So when we swallow, this whole structure is going to move up as the larynx and pharynx move superiorly, right? Some things we usually know, right? We have this cavity in the frontal bone. We have a cavity here, which is called a sinus in the frontal sinus and the sphenoid sinuses. Each one of these are going to contribute to the moisture that's on all of the nasal membranes in the nasal cavity.